You only get one body, you need to take care of it. That's why we're revealing these self-exams that you should know about. And here's one that may be new to you.
Hi doctors, when I was in college I was diagnosed with mono, and I was shocked at how swollen my throat and my glands got. Recently I've been trying to stay super fit. I work out a lot, I stay healthy, I do yoga. I was wondering, can I tell if I'm getting sick by doing a self-exam of my lymph nodes? And if so, where are they? And how can I tell if they're abnormal?
So the lymphatic system is a part of your body's immune system. Lymph nodes are throughout the body, and they connect, believe it or not, something called lymph. And what lymph is, it's basically fluid, it has white blood cells, and it also carries around bacteria and viruses. And in the lymph nodes, you can think of that as an army base. It's where these white blood cells produce antibodies that will attack these viruses. So what can happen? You're absolutely right. When you're sick with mono, strep throat, skin infections, those lymph nodes near the site of that infection will become sometimes inflamed. And what you can do, it's a pretty easy self-exam. You'll see me do it in the ER all the time on my patients. Take the pads of your fingers, and this is obviously your neck lymph nodes. Just gently roll your fingers, feeling for little nodules, okay? And if you feel a small rubber-like nodule, it's freely mobile, it doesn't hurt too much, you could just have some inflamed lymph nodes, secondary to infection.
Pea or something small.
Exactly, and oftentimes under your armpit. You may need to press a little bit harder underneath your armpit to feel them. Also in your groin area, a very common place for them. But when do you need to worry? Well, when it's kind of a larger node, over 1/2 inch in diameter, it's not mobile. It doesn't have that rubbery texture, and it just feels abnormal. Or let's say it's in an abnormal area for a lymph node to be reactive. Back of your neck, maybe over your clavicle, your elbow, your knee, something like that. Then you should go get it checked out. Because, yes, your lymph system is there for a reason, but things like leukemia, lymphoma can first manifest themselves within the large lymph
as enlarged lymph nodes. For women, so important, enlarged lymph nodes in the armpit.
Absolutely.
Because that's where the breast drains, and in the neck, like you mentioned, these lymph nodes, all the lymph nodes.
Well, and maybe the answer is, we've talked about know your breasts, know your testicles. You really should know your lymph system.
Sure.
I'm just going to be honest with everyone. I have lymph nodes that are always there. And I do periodically feel them, and they stay the same size for a long time.
Making sure they're not getting bigger, or
painful.
They sometimes can get infected. They'll be much larger. Even sometimes you'll see red, very tender. That's the time to see the doctor too.
Absolutely. Well, there is something called lymphatic drainage, which is a holistic approach. It's a type of massage technique. It's certainly not right for everyone, but many people do believe it has some amazing health benefits. And so we have Liza here. She's a lymphatic drainage specialist. She's from Spa 415 here in Beverly Hills, and she's going to show us how this works. So, Liza, take it away and talk to us about what you're doing in there with Bridget.
What I'm doing today is a form of lymphatic drainage called vacuodermy. It's taking a light suction cup and it's directing excess fluids that are located just beneath the surface of the skin, and we're directing it toward one of her primary lymph node areas. And this helps to drain excess fluid retention.
And so this is truly designed to do that. And why should someone consider doing this, Liza?
Well, some people have poor circulation, and so it translates into excess fluid retention. And so this, again, it just helps take the excess fluid and drains it through the main channels, the main lymph drainage areas, one being also under the arm.
We like using this after surgery for patients, especially people who have had surgery in the face and the neck, just to get some of that swelling out to improve circulation and venous return.
And also breast surgery. After breast cancer, you can have really swollen lymph nodes that can really be debilitating. So a physical therapy, which kind of involves sometimes a lot of that type of technique, is crucial to these patients.
And your lymph system can become incompetent. People with lymphedema, just like people with heart failure can have a lot of edema in their legs, you can have edema in your legs secondary to the lymph system. So
it's the kind of thing, if it's working well, you don't notice it, but if it's not, you do.
You do. Thank you so much, Liza and Bridget. We appreciate you being on the show.
Thank you very much.
Coming up, is your doctor concerned about your cholesterol? We're showing you how you can keep track